Men, we don't often see as much, but like I said, you might notice that your semen is not as forceful when it comes out. That's usually the most common sign of a weak pelvic floor. There's not as many for men, but in terms of an overly high tone pelvic floor, what we worry about then there's a whole host of symptoms. It could be as simple as just having lower back pain. It can be that you're having hip pain. It could be that you're having pain with sex. You're having pain with erections, pain with ejaculation. You're going to the bathroom often. Gotta go, gotta go. You are feeling like you're having difficulty emptying your bladder, or you are going very, very often all of a sudden. And so generally, it's important to get evaluated to see, to get your pelvic floor examined by a professional, whether it's a urologist, a gynecologist, a pelvic floor physical therapist, someone who can assess your pelvic floor if you're having these issues, because it might be pelvic floor, it might not, right?
How do they assess it? If I go to a urologist and say, listen, check my pelvic floor.
Mm-hmm. So in a man, it would be a rectal exam. And so essentially, that's how you sort of feel the pelvic floor muscles. So what I tell young guys who come to me, I said, look, I can examine you, but I bet based on your story, like you're a young guy, you've sort of had these new stressors in your life, and and you're otherwise healthy. It's unlikely that you have a vascular condition brewing and other things that it's probably likely. So if you want to avoid the exam because it can be uncomfortable, and I will tell you, if you have pelvic floor dysfunction and someone does an exam, it will be uncomfortable. It will be painful, potentially, because they're pushing on those already tense muscles, and it can be painful. So I tell people, you might hate me tomorrow because you'll be sore and you'll say, what did she do during that exam? And I kind of preemptively tell them, because I just gently push, right? Like I'm pushing the pad of my finger, but that's enough to sort of cause a tension of the pelvic floor muscle and cause pain.
Push where? Where are you
pushing?
pushing?
On the muscles, on the pelvic floor muscles. So you can actually, so if you put your finger in the rectum, if you push straight down in a man, you're feeling the prostate. And if you push on the sides at a variety of different angles, you're going to feel different pelvic floor muscles, like the levator ani and the transobturator muscles. Those muscles are the ones that are part of the pelvic floor. We can't feel all of them, but we can feel some of them. And so that is sort of where we're feeling in terms of for the pelvic floor muscles.
Okay, so because I was thinking, if we go in the rectum, you've got the glutes there as well, which are like either side, I guess.
So your pelvic floor is actually a part of your core, right? But your glutes are further back. They're not going to be felt from there.